gotta forgive me because I got a little cold today. I don't stop when I get a cold. Just fixing me up a little protein shake here. Save that for later. So we're off. Dr. Andrew Feldman, M.D. I grew up in Jersey. You know, I'm a Jersey guy, Bruce Springsteen guy, through and through. I am chief of sports medicine at St. Vincent's Hospital. Dr. Murray, are you with me? Yes. All right, we got a rock'em sock'em day here. New York is an extension of who I am. Just look around, man. We're in 42nd Street, right here. I'm somebody who is kind of on the go and a little bit frenetic. Whew. Very slippery, these floors. They always wax them. Just to do a little cross-country skiing. The reason I chose sports medicine is because it seems to be congruent with the way that I am. I'm an athlete. I am a caretaker. Way ahead of the game, man. You're gonna give him an A+ today. I like to fix things. My patient went in. I gotta go. It's like a glove for me. He's going in without me. Can't do the surgery without me. It fits. For example, if you have very flat feet and you have arthritic knees, you shouldn't be a runner. I mean, that's all there is to it.
Would you say my feet are flat? They're pretty flat, aren't they?
Well, it's hard to tell. They look great from here, but
is that a flat foot?
I have to kind of sit it. Well, you have a bunion, which means that you probably do have a flat foot. I have time on Tuesday if you want to get that fixed.
Tell the world.
Most of us sleep with pillows here, not under our feet.
Yeah, pillows under the head are good. Too many pillows are not so good. They can put a lot of strain on the trapezial muscle in the back of the
I have 16 pillows on my
16
bed.
is way too much. I'd lower it down to 12 at least. It's my friend Jimmy Burke, and imagine he's just been playing soccer and dislocated his shoulder. What we would do is have him lie down on a bench of some sort so he's dangling, pull a little bit of traction on the arm, and then just twist it back and fro. Any mom or dad could do this. The only caution is if it doesn't go in easy, don't keep trying. Ice is the best medication that anybody can buy. This is my friend Keith Teasdale, who will assume hurt his knee playing basketball. You just pop this puppy on there and press a little bit, hold it on there for 15 or 20 minutes, and you're as good as new. Sleeping on your stomach is very, very bad for your back, and that's going to promote further problems. Try to turn yourself on your back, and that's going to ease a lot of the stress off the lower spine, make you happy.
Dr. Feldman says wearing a baseball cap to bed can help reduce back pain. Oh, won't that be cute?
This is a little trick that I invented because I am a sufferer of back pain for a long time. Most of it has to do with sleeping on your stomach. When you sleep on your stomach, there's a tremendous amount of pressure on your low back.
Aren't y'all stomach sleepers?
A lot of people are.
A lot of people are.
And I'm telling you, 90% of back pain.
It's just so cushy that way.
It is, and then you suffer the whole day. So if you have your hat on and you start out on your back and for some reason you roll over, you bang the bill and you flip back up.
So all of us should be sleeping on our backs?
Back or in the fetal position. Those are the two recommended positions. You could cure 90% of back pain right now by people not sleeping on their stomachs.
Really?
Absolutely.
I'll think about it. I'll try. Yeah, I'm just going to love that baseball cap. Thank you so much, Dr. Feldman.
Pleasure. A lot of people sit slumped. The basic way you should sit is upright, like this. And sometimes you have to train yourself to do this. And I see a lot of people in the audience changing right now.
They're adjusting.
Exactly. Everybody has their own pressure points.
Yes.
I mean, you really would inquire with the person who you're massaging. There are certainly pressure points that are where yours back
right here.
Yeah, me too. So basically, you would, yeah.
This is excellent. Oh, thank you, Dr. Feldman.
Yeah, we'll be giving these later. You may.
It's totally unfair as far as I'm concerned. So what's the difference between that kind of a massage and the kind of a massage you would get in a chair and all the other kinds?
Yeah, the basic massage, the most prevalent is the Swedish massage. That's the sports massage. But there are a lot of different ones. Shiatsu, which is pressure points, reflexology, something called Rolfing, which sounds to me like a college party game or something.
Right.
But
is there a guy named Rolf who'll come in and do that with
There's
us?
a woman named Ida Rolf, and that's very deep tissue. It can be very painful. I've seen grown men weep.
In his new book, The Jock Doc's Body Repair Kit, orthopedic surgeon Andrew Feldman gives you the tools to figure out why you hurt and whether or not you need to see a doctor. Dr. Feldman, good to see you.
How are you?
Why did you write this book? I mean, you're a doctor. This is your business. Why tell people how to possibly avoid going to see a doctor?
Well, I've been in business a number of years, and after a while, I began to realize that I was seeing people in my office who they just didn't need to be there. They either were fearful of an injury or perhaps unknowledgeable about something. And basically, what the book does is it takes people step by step through injuries to be able to potentially allow them to treat it at home. It's interesting because it could put me out of business, but it's a book written by a doctor about how to stay out of his office.
And what do other doctors say about you doing this?
Well, hopefully. I haven't had any negative feedback yet, but you know, any honest guy doesn't want somebody to be seen who doesn't need to be seen.
But the bottom line is you're not telling people don't go see a doctor. You're saying know the difference between a slight aggravation and something that needs to be treated by a doctor.
Sure. The majority of injuries are usually the aches and pains, you know, not the big blast when you fall down a ski mountain. That's what the book helps you do. We at home see what the television shows us in 3 or 4 burnt out buildings, but the devastation is really almost a 5 to 10 block radius of just twisted rubble and, you know, rescue cars that are burnt out and fire engines that are basically crumpled like little tinker toys. It's quite devastating.
Tell us, if you would then, while we look at the pictures, as you point out, that the rest of us in the country use to get as close as we can to the crisis itself. Tell us, just looking at these television pictures tonight, you can use daytime or nighttime, whichever you prefer. What are we missing?
I think you're missing a couple of things. I think you're missing the amount of individuals that are there really doing their job and much more than their job. I also think you're seeing a lot of rescue workers on TV. But I mean, one of the most interesting things was I was walking down the street and my car mechanic was there hauling cars out of the way. Now, this is a guy, he's not hired by the city. He was volunteering to help clear some of the rubble. So there's a lot of normal citizens there who are going above and beyond the call of duty, so to speak, to help with the rescue team as well.
And I think it's probably true that as we look at this on television, we don't have any appreciation for the depth of the rubble, or as you said, within a 5 or 10 block area, the compacting of the rubble as these buildings fell in on themselves.
I think the way that you can really visualize it is if you think of a disaster movie from the summer. I mean, that's really what it is. You go there. My office is actually across the street in Battery Park City, or what was my office, because I saw it and it's pretty much blown out.
Really?
But it basically is an area that you know very well, that is no longer an area you know very well. It looks as if an atom bomb had dropped there. Mr. Shields, how are you, sir? Nice to see you. The size of the lesion on that area directly dictates what I do. So I'm going to be kind of like a cat on my feet because I don't know what I'm doing just yet. I'm prepared to do 2 or 3 different things depending on what we see. Do you have any questions about anything?
No.
All right.
You got a good night's sleep, right?
Always. I only had 3 martinis this morning.
Only 3?
Yeah, I usually have 4, so I cut back 1. Orthopedic surgery never gets boring for the following reason. These things that I am operating on are not inanimate objects, they're people. And every person is different and everyone has a story. And you do, for whatever reason, have some sort of a bond with that person, even if it's only for a temporary amount of time. How much were you running before your knee injury? Doing marathons and stuff?
Yeah.
What's your personal best?
Personal best, 355 on the wow.
Not bad. Okay, foot down, please. Table up. I've been in practice for a number of years, and I can't say I'm the old sage, but I'm certainly adept at what I do. Okay, tourniquet up. The feeling is, well, I've done this 1,000 times. It just can't go wrong. And you feel that great confidence that you have mastered what you set out to do 20 years ago. That's probably one of the highlights of my life, to really feel that way. Okay, let's see what we got here. Lights out, please.